The context for what we are trying to do is that for a very long time, for almost 10 years, we've had a health sector that had been underinvested, had not been prioritized as much as it should have been, except for during the COVID-19 pandemic, with huge issues in access to basic healthcare services by all Nigerians, with very tepid progress in terms of access to health insurance, financial protection, quality of care, with underdeveloped infrastructure in higher facilities, huge issues of health worker attrition, outward migration, discontent in the sector from multiple reasons, and of course different outbreaks. That's the context. When this administration came, His Excellency President Bola Ahmed unveiled the Health Sector Renewal Investment Initiative in 2023 with 4 pillars for the reform agenda in the health sector. One was to improve the governance of the sector, bring in federal government, states, local governments, and external development partners under one compact, which was signed by all the 36 state governors, to work together to invest in areas that will improve population health outcomes, to orient the sector to responding to Nigerians' needs. And that was backed by a survey that asked Nigerians, what did they expect? What was their experience? So that we can track, and we now see, in fact, the progress that has been made between 2023 and 2024. There is very credible evidence of that. To improve transparency, accountability, to raise resources. We've seen the allocation of federal resources to health almost double between 2023 and 2025, which signifies the political commitment of this president to transform Nigeria's health sector.
You've mentioned you've gone through a plethora of issues there, investment, infrastructure, personnel. I just want to take them one by one, not all of them. Mm-hmm. One of the first things you talked about was how very little was being invested into the health sector pre this administration. Now, in August last year, I think it was, August 2024, there was an Abuja Accord that was signed by African Union states who said, who committed 15% of their budgets to the health sector. The Nigerian budget this year for the health sector is less than 5% of the national budget. Would you call that an improvement, or is it a work in progress?
I think what you're referring to, it was not in 2024. The Abuja commitment was announced in 2001 by African heads.
There was a recommitment last year.
The Abuja commitment has been in the cards since 2001, since the MDG eras. And only 3 countries in Africa by 2015 had met that target. So let's talk about Nigeria's health finances situation. Nigeria has not been spending as much as it needed to in health for a very long time. And part of the reason is macro, because the revenue to GDP ratio of Nigeria is among the lowest in the world. The resources the government collects was limited at federal and states, and how much it appropriates in health was then lower in terms of absolute number. So $14 per capita of public financing, both federal and states, is insufficient. Many countries like the UK, where you spend thousands of pounds per capita. But because we collected little, and because the little that we collected was further constrained by things like the subsidy that was being expended before, government resources were limited, and so the investments were lower. Recall when this president came, subsidy was out. He took huge, bold steps to expand the fiscal space of government. And within that expanded fiscal space, begin to allocate more into the social sectors like health, like education. And at the subnational level, states also to be able to allocate more of what they have. By having a compact and increasing the federal contribution, the federal budget, we also expect the states to match and local governments to match. That's why the compact was set up. And some states now have also increased significantly their investments in health. So when you look at Abuja commitment, when you're computing it for a country like Rwanda, it's a centralized, it's a unitary system. Where a federal system like that, you have to look at the totality of the budget of federal government, the states, local governments, and see what is it. But beyond the absolute quantum of resource, it's also the efficiency of how that money is used. You can spend a lot. Some of the highest countries in terms of per capita spending in health don't get the best buys in terms of outcomes because there are many inefficiencies. So what we're saying is that with the resources that we have, let's use it properly. Let's allocate it so that it addresses the basic needs of everyone. That's why we're expanding the primary healthcare system. Let's protect the poor and the most vulnerable. For the additional resources, let's invest in high value tertiary and specialized services, because our health system is in an evolution and is in transformation. If you allocate even much more overnight, you can waste what you allocated. But in our system, we needed to reform the healthcare system, organize it better, and begin to spend well. And with that, we've seen a steady increase in what is being allocated and the external financing that we're able to mobilize. So it's not about the number. The number is just a number. It's about the performance, the productivity that you get out of the health system. And that's the angle.
But then in this government's plan to hit that 15% of its budget for the health sector,
I think you should look at it from the point of view of the resources that our government have. We collect 8% until recently revenue to GDP. Average in the continent is about 15% or thereabouts. In some countries, 20-25%. So government has to collect the revenue before it spends it. And the macro fiscal reforms that the government is undertaking is to unlock that, whether it's subsidy, whether even the tax bill that the president is pursuing, so that you cannot get the highest quality health for the cheap.
Absolutely. No, and I get that. I was just trying to find, what your end game is. And I think I have a clearer picture of it now. One of the places with the biggest issues when it comes to healthcare definitely are rural areas. In the last year, I've traversed this country, different rural areas, looking at different aspects of the country. You've mentioned a lot that you've done for these rural areas, but let's just be honest that if somebody has to have an operation very quickly, an emergency operation, for instance, it is still very, very difficult to have that in my village, Uju, in Benue State, for instance. You'll have to traverse bad roads and try and get to the capital, Makudi. How quickly are you hoping that you can improve the situations, especially in our rural areas?
It's a journey of transformation. And I have to tell you a personal story here. My own father, who is in his mid-80s, recently had a major domestic accident in my home state. We took him, we brought him to a public hospital, and he had a major surgical procedure. He had his issue fixed. Within 6 weeks, he's standing up, he's able to move. Now, that may not necessarily represent the experience of everyone, but personally, as a minister, I could see the tremendous capability that exists in the Nigerian health sector. The professionals that we have who are very skilled. They may not have all the fanciest buildings and gadgets, but they're able to put, for me personally, the most important person in my life, and for him to be taken care of in a public facility, which is really signifying the potential that exists. But it's not yet completely fixed. We're on that journey of fixing it to make it better over time. And that with this president's commitment, I believe that if we continue on this path, we will see the public hospitals doing a lot better, at least federal facilities, but also even the states mirroring what the federal government is trying to do. And at the rural areas, the primary healthcare can be able to attend basic issues of malaria, immunization, pregnancy, normal pregnancies, and complications can be referred. You cannot have surgical capability in every rural area where a large country. You have to have referral centers, secondary facilities, and anesthesia, anesthesiologists, for instance, surgical capabilities that are at the level that is necessary, and you have to have a referral system. That's why we expanded the Emergency Medical Services and Ambulances Scheme, NEMSAS, which had existed previously, but we accelerated the pace of its expansion. So there are ambulance systems that are available. Not yet covered the entirety of the country, but gradually we're expanding it. The way to think about this is we've done 2 decades of start and stop efforts. We've come 2 years with a convergence of effort, with strong political leadership of the president, with resourcing, with mobilization of other financing, with state governments also joining hands with the federal government, with local governments coming together, and with Nigerians supporting this direction. If we continue on this path, we'll get to the point where everywhere you go, either you have a basic ailment treated, or if you have higher level services, higher level illnesses that require surgical intervention, you can be referred and that you can afford it.
Another issue that beleaguers the health sector is the Japa syndrome. You know, so many medical personnel, doctors, nurses, pharmacists leaving the country. How are you planning to curb this, to make them realize that, you know, you can make life better for them as well here?
So the Japa syndrome, surprise, surprise, it's not just a Nigerian phenomenon. It's a global phenomenon. There's a global shortage of health workforce, 18 million health worker shortage globally. Some countries in Europe are aging, they need health workers. United Kingdom, United States and all. In fact, you'll be surprised to know, and you can check this out, Canada a few months ago was putting restrictions on their health workers from leaving because they were losing some of them to other countries. So Nigeria is not an isolated case. But what we decided to do is to solve the issue, respecting the rights of individuals to travel abroad if they wish, to educate themselves for family reasons, or just a matter of choice. We're a free country. But how do we respond to the need that we have? And knowing that we are training our health workers so well, that's why they are attractive to the rest of the world. If we didn't train them well, nobody will take them. So we're proud of that we should train them well, the quality that is needed, so that if they choose to go, they go, but some will stay. And we, at the same time, appreciate those who remain to serve. One of the things that this administration did was to double the quota. So we produce more. For almost 30 years, the quota of health worker training had not been changed much. We doubled it for medical school, pharmacy school, and schools, and put a caveat that the schools will have to be accredited, will have to maintain the quality so that we are not trading volume for quality. We lose quality by increasing volume. That's what we're trying to do, so that we consistently increase the production, but also high quality production.
Okay, I just want to move away specifically from your ministry now and just look at the relationship the president has with, you, the ministers. Does he listen to you? I mean, or when you're in your Federal Executive Council meeting, does he have the last word? Do you guys have robust arguments and sometimes he says, okay, you guys win?
Yes, I think you should understand that here's a president who is not only a master politician, but he's also a very consummate businessman, a technocrat at his beginning, a leader who has a lot of empathy, who is a team builder. And he has demonstrated that over time, politically, administratively, has done so much in his own career, who is now at the helm in Nigeria at a time where Nigeria needs that leadership to change its trajectory from a very tepid one to one that is really very positive trajectory towards the prosperity that he sees. So at the Federal Executive Council, one of the first things he said, look, I'm the chairman. So here's Mr. Chairman. And it's a very collegial spirit, but it's a team that is very open, that has been intentionally crafted to build trust, to allow for divergence of views, to constructive ideas in a respectful manner, get listened to. And he's been very reasonable where reason is met. I think the president listens carefully. He also has empathy. I think he can understand things. He can put himself in other people's shoes and be able to judge. At least my interaction with him, both in the council, but also in other areas that I've seen him operate, I see a leader who also has significant empathy. And that is key to his ability to read the room and read issues well and allow his team also to advise him and several other advisors that he has. So that's the beauty of experience in a leader that we currently have.
Honorable Minister, thank you very much for your time.
Thank you
Much
very much for
appreciated.
having me.